But what's the difference today in picking up that cigarette or picking up that cigarette some 20 years ago when in the movies people were smoking and that was the cool thing to do?
And they were dying of cancer of the lung at that time too.
Mm-hmm.
I think the advertising, there is a book, I think it's Professor Warner at the University of Michigan has come out with a book called The Selling of Smoke, which chronicles the campaigns where in his book, the tobacco industry has targeted minority communities and especially minority women. It has been very successful, and they also have a very good lobby. I think Philip Morris is probably one of your greatest contributors to black colleges. They support the Joffrey Ballet. They support many of your singing groups, provide free concerts. So when one attacks these people, one has a formidable foe.
Let me touch on a point that you made. Back 40, 50 years ago, people were smoking more and people were dying more of lung cancer. But as we found out how to handle these risk factors more and medical technology improved, we've had the non-minority sector of our country take the benefit of that. So what we see now is a widening gap between 5 or 6 major diseases that blacks are dying from that whites are not dying from the same rate. There's a concept in public health called excess deaths. For 1979-81, about 230,000 black folks died before the age of 70. About 59,000 of those persons, if they'd had the same experience as whites had, would not have died.
Well, I guess what I was trying to get at, though, as far as the smoking, and let's group some of the other categories in terms of that, there has also been slick advertising for black folk and white folks in terms of exercising in the last few years and understanding the importance there.
That's not available for $1.37.
Okay, now, and I don't even mean having to go to Vic Tanny, and that's what I was going to ask you about in terms of that. I mean, it'd be nice if you can go to Vic Tanny and use the machinery, but obviously to stay in shape, you don't have to do that because people did that before.
Image is.
All right, now let me ask you this, and this is what I'm trying to get to in terms of the lifestyle. Is it that black women are having a harder time, and you tell me if this is making an excuse, because sometimes they tell me I don't make enough excuses for black women. So here we go, ladies. Is it that they just don't have the time to exercise because they're trying to take care of the home and the family because of the statistics that show black women are heading the majority of the black households? The stress level is there, that's why perhaps they're drinking more and smoking more? Or is it just as she said, it's such a slickly packaged item that this is what's going on?
So we don't confuse things, are we talking about now exercise?
I'm talking about all of the things.
I'm
trying to group why black women are having this problem.
I think there are multiple factors, and I don't think there's no way we can simplify this into one easy category.
All right,
I think
what are some of them?
all of the above are factors. I think the having children at an early age and the frustration that comes with that problem, being unemployed, not having a proper education, all of these are factors that tend to frustrate, and then once one fits that situation, they will compensate in many ways that may be injurious to their health.